Okay, today we're going to do a little bit with gynecological applications of Tui Na. And so depending on what we're doing, a lot of times you're going to have someone who's coming in with menstrual irregularities. You're going to want to figure out what the correct pattern is for this. It can be many different things based on their tongue and pulse. And so we would look at it, commonly being liver qi stagnation, with or without a spleen qi deficiency, possibly a blood deficiency. You could also have a kidney essence deficiency. And so usually it's going to be a deficiency syndrome unless there's stagnation. And it can also be a combination of these things. Okay, so we check the pulse. And then some basic techniques we're going to do are going to be on the abdomen. And in the case of liver qi stagnation, a little bit on the chest. And then we'll do distal points just as we would in an acupuncture treatment. So basic round rubbing on the abdomen. So we're going around the umbilicus. This is also good, we know, for constipation, for any kind of digestive issues, disharmony. And then in the case of somebody having fibroids, she's ticklish. It's okay. See, we make patients laugh. You could do gentle rolling. So gentle rolling, you'd still go into a clockwise. Okay, we're not really going to move anything, but we're going to get some qi and blood moving in the abdomen. In certain cases where there's surgical laparoscopic scar tissue, you might want to do revolving. You might also want to do grasping on the abdomen, focusing on Ren 4 and Ren 6. But this is just rolling. So this is good for any kind of menstrual irregularity. So supposing that we have cold, we could do rubbing across Ren 6 and get a little bit of heat generated. And then you could also do vibrating. And so here you can just literally vibrate the hand, and sometimes you'll put one over the other. Or you can just relax and send qi to the lower abdomen. Now, in the case of a liver qi stagnation, we would work on the upper chest, avoiding the breasts. And so here, I'm just going to tuck this here. And so I would push from the center out along the rib cage. And this is really nice for a patient who comes in, has a wiry pulse, more liver qi stagnation. They might be sighing a lot. And we would do this bilaterally. So I'd go over to the other side of the table to do her left side for liver qi stagnation. Now, depending on her pattern, I might then do some kneading along the kidney meridian, nipping or rolling along the liver meridian, and maybe one or both along the spleen. But it's usually going to be the kidney, spleen, and liver that is mostly a part of any kind of menstrual irregularity. And that's just a couple of different gynecological applications of Tui Na.